Within the United States, there are about 550,000 people who are on dialysis or with a kidney transplant, so who have hit end-stage renal disease. And every year, another 100 or 150,000 people start dialysis. Less than 1% of the population is on dialysis, but it's 10% of our healthcare budget. If we can prevent people from reaching end-stage renal disease, we can reduce that cost, and we can also improve the quality of life for people with progressive kidney disease. Our goal was to look at information about all of these people starting dialysis and to find ways that we could prevent this progression to requiring dialysis. And so we wanted to look at how much nephrology care individuals had received prior to starting dialysis and whether more nephrology care was related to better health outcomes.
It's amazing that even in an advanced country like the United States, that half the people or nearly half the people that arrive at our doorstep have not received formal care by a nephrologist. Only about a quarter were under the care of a nephrologist for a year or longer, and another quarter between 6 to 12 months prior to reaching end-stage kidney disease. Now, these periods of time are not sufficient to engage in therapies that would slow progression, for example, or adequately prepare somebody physically and psychologically for the onslaught of end-stage kidney disease.
We found that nephrologist care was associated with better health outcomes. Individuals with more nephrologist care prior to starting dialysis actually were better prepared, they had better physical results, they had better health outcomes, they had better serum hemoglobin, serum albumin levels. They were more aware of their kidney transplantation options. They were also less likely to die after initiating dialysis.
The nephrologist has the luxury of focusing primarily on the kidney disease, so they can more systematically, if you like, go into the nitty-gritty of not just the kidney disease or what kind of kidney disease it is, but also go into the associated complications of kidney disease much more in detail than a general practitioner would have time to go into. Ultimately, it's a partnership between the primary care physician and the nephrologist that's critical, I think, in improving outcomes for our patients.
We found that nephrologist care was associated with better health outcomes.
If you know you have kidney disease, then you ought to insist that you see a nephrologist early on.